And let's find out more on this development from a senior health advisor, Lagos Health Summit, Dr. Azeezat Yishawu. She joins me live via Skype from Lagos. Good to have you join us, Dr. Yishawu.
Good afternoon.
Right, so a lot of health experts like yourself have said that we do not have enough vaccines in the country to even ascertain whether there is vaccine hesitancy. But it does seem like the federal government is now hinting at the fact that there might be vaccine hesitancy among Nigerians. Talk to us about what you're witnessing and noticing in terms of these vaccines when it comes to behavioral attitude or behavioral change rather from Nigerians.
Thank you so much for. I think that the decision or this hint by the federal government is just, as a result of frustration in trying to get enough Nigerians to get even the available vaccine. But it's not necessarily the ideal solution or the ideal way to do. We are not in a militia government, and as such, that is not the right thing to do to encourage or to change the behavior of any citizens whatsoever towards COVID and toward the COVID vaccine. The denial or the refusal to take vaccine is not a Nigerian problem. It's a global problem. A lot of advanced countries are facing anti-vaxxers, are facing people that would not even believe that COVID exists, and their approach is not one that that has brought about this idea whatsoever. So at the end of the day, there are several steps you understand me that the health sector employs or deploys to encourage and incentivize people to take any form of medication or any form of new invention in the medical field. And one of the things that propel or encourage people to take up new ideas is information, is knowledge, and is aware. For me, when the several strategies to roll out COVID-19 started, the TEACH program was something that I felt was very, very relevant, or was a good strategy, especially the door-to-door registration and vaccination of Nigerians, and that is something that we are yet to see. I'm yet to see that door-to-door visitation, that door-to-door vaccination of people, speaking to people, creating awareness.
And even just door-to-door awareness, Dr. Azeezat, because like you rightly noted, the biggest issue with this vaccine, even just generally COVID-19, has not been lack of information. Rather, it has been misinformation. I would see the barrage of just conspiracy theories every single day. Some say if you put it in your hand, it's like a magnet. We need to do more in terms of having to ensure that people really understand that these things are not true. But let's look at the fact that even abroad, like you rightly noted, in countries like the US, even health workers are rejecting these vaccines. Are we having the same issue here in Nigeria, where you have those within the health sector also saying they are not going to take the vaccine?
I think for me, I can't particularly speak for other sectors, because as far as my own exposure has been, everyone within my circle, every health worker, both medical doctors, both nurses and pharmacists, especially those who are working in hospital areas, who are working in the isolation centers, have taken the vaccine, and have encouraged their members as well to take the vaccine. So for me, if there are any health personnel whatsoever that have not really being comfortable with the vaccine, then I think it's imperative for them to gather more information, because the vaccine is not they shouldn't be among those who are propelling the conspiracy theory. Rather, if they have reservation, then it is best for them to seek information that will allow them to make the right decision for themselves and those within their community as well. But then it is just human nature to to always doubt and find alternative to something that we are not aware of, or we do not have enough information for as well. So I think that's that for me.
All right, we'll see how this plays out. We're now taking the Moderna vaccine in the country. We'll see how Nigerians respond to that, and the J&J as well. Thank you so much for talking to us, Azeezat Yishawu.
Thank you so much for having me.